Hello friends, this is Dr. Ezeugwu coming to you. Today we will be discussing proper management of hypertension during pregnancy. As we have discussed previously, there are different types of hypertension during pregnancy. One is chronic hypertension, where you have high blood pressure issues even before becoming pregnant, or you develop hypertension during pregnancy and it continues to 12 weeks or beyond after delivery. Two is gestational hypertension, where you develop hypertension 20 weeks into your pregnancy. Three is preeclampsia, where the hypertension during pregnancy is now complicated with protein in the urine because the kidney is now being affected, or even the liver. Four is eclampsia, where the hypertension is now complicated by seizures, which cannot be explained by any other condition but the hypertension during pregnancy. Now, let's talk about management. There are different forms of management. Among them are, of course, monitoring, which is very important for early detection. Then, of course, lifestyle modification. Then, medication. And then, delivery, hospitalization and delivery. Let's discuss this in more detail. Let's talk about medication first. If you have chronic hypertension and become pregnant, it is important to understand that many medicines used in managing blood pressure are not allowed during pregnancy because they can affect the fetus. So it's important to discuss your medicines with your doctor when you become pregnant so they can remove those ones that can affect the fetus and then use the ones that are safe during pregnancy. This underscores why it is important to be managed by a doctor who understands these things when you're pregnant. Now, it is also important to understand that when you're being placed on medication new, that the doctor knows the proper medicine that are safe during pregnancy to use for you. And it's important to detect the condition early so that they can put the medicines early if it's going to be used to prevent the progression of the condition. Because as you know, chronic hypertension can be complicated by preeclampsia or even eclampsia. The same way a gestational hypertension can be complicated as it progresses to eclampsia. Of course, it can go to preeclampsia before it becomes eclampsia, but these are all progression. But if you detect them early, you can then manage it properly and prevent the progression. So what about monitoring? We encourage monitoring blood pressure even before you become pregnant. We recommend the use of remote patient monitoring to monitor all patients during pregnancy. In that way, you can detect this condition early and manage them properly. Remote patient monitoring is where your blood pressure is checked at your home and is transmitted to your doctor automatically every day, and the doctor can easily detect when the pressure is having an issue and then manage it with you properly. The next is, of course, lifestyle modification. If there's anything you are doing that is causing the blood pressure to go high, avoid them. Whether it's a stressful condition or diet or salt intake or any substance use, avoid them. Now, when you have conditions such as preeclampsia, which is really complicated, or develop eclampsia, then hospitalization for early delivery becomes very important. Not only to save the fetus, but also to save the mother's life. Remember again, early detection of blood pressure at any stage is very important to institute the proper management and prevent progression and complication. Also remember that once you develop hypertension during pregnancy, the chance of developing another hypertension during the subsequent pregnancy is higher, and the chance of heart complications such as heart failure in the future and also reduction of longevity is there. So it becomes important that we really detect these conditions and manage them properly and reduce complications. Again, this is Dr. Ezeugwu coming to you about proper management of hypertensive disease of pregnancy. Thank you.